Session 7.
These are the learning outcomes for this session.
So session 7 is all around moving more and sitting less. And similar to the other sessions, we start off with scoring how we're progressing towards our nutrition goal, our physical activity goal, and our lifestyle goal. And then we go on to entering our weight, which will automatically calculate our BMI. We'll enter our waist circumference, and then we record our steps. Then we move on to some education about moving more and sitting less, and just some points to follow open up the conversation with your patient. Doing any physical activity is better than doing none. If you are not currently doing any physical activity, you'll benefit from starting some. You can start slowly and gradually increase. The aims of doing physical activity would be to aim for at least 30 minutes of physical activity most days of the week. You can accumulate your activity by being active on most, preferably all days of the week. And there are many opportunities to sit in our daily lives. The key is to find opportunities to move. We'll move on to some other educational points about moving more and sitting less. Moderate intensity activities take some effort, but you're still able to talk while doing them. Just in case you didn't know the difference between moderate intensity activities and vigorous intensity activities, vigorous intensity activities require more effort and make you breathe harder and faster. So you're huffing and puffing. And just has some examples there of some activities that may be included as a vigorous activity. And then in your resources section you have a tab and lots of points about the physical activity guidelines and the recommendations, including muscle strengthening activities on at least 2 days per week. Down the bottom also we have another tab which just explains a little bit more about muscle strengthening ideas, and that body weight exercises like push-ups, squats and lunges, you can do them at home and are very beneficial. And that you could also do tasks whilst at home, doing normal housework and chores around the house. And also you could join a gym or do weights or other resistance training. Here are some other talking points that you can have with your patient about moving more and sitting less, and why not try these ideas. So thinking about when and where you can be physical activity in your normal daily life, and making some small changes to your daily routine can also make a big difference. Just some other tips about active travel. For short trips, walking, cycling and leaving the car at home is a good one, because we all know that with the access most people have to transport and cars these days, that we're actually walking a lot less, or even cycling. Not many people are cycling these days. For longer trips, walk or cycle part of the way if possible. Taking the stairs instead of the lift or the escalator is a good way, especially if you live in an urban area where you live in an apartment. Getting off the bus one stop earlier and walking the rest of the way, especially if you're coming home from work and you've sat on the bus for a long period of the day, a long period of the travel, and parking further away from your destination and walking is another tip about being active. Being active at work, some other tips here about parking your car an extra 5 or 10 minute walk from work away. Just organising things and having to think about how you can incorporate being more active during your normal daily activities at work. here's just some other tips about physical activity and also having fun. So just some ideas about how you can incorporate those things into your normal daily life. And then we can go on and view the report. You can also have the discussion with your patient around their how they're progressing towards their goals. And that's the end of session 7.